destroying my country. I want you to stop destroying my country.
Socialism.
Go to
Obey the
Cuba.
Constitution.
Go to Venezuela. Join Chavez.
I want to say hello. No, I want to obey the Constitution.
Hey guys, it's nice to see you. I know we're on the opposite side of the aisle, but you've got to realize that when you scream stuff like socialism and communism, you are not helping your cause. Because people look at it, and they look at the systems like Medicare, that is a national system, and they will never think of it as communism. It's a single-payer system. Have a good day.
Secretary Sebelius and Administrator Mills will welcome you to join our great Senator Dodd and Rosa on this podium. Thank you very much for coming. Every one of us here in this room was a patient, is a patient, or will be a patient. Sitting in this room, we have 2 cancer survivors, Rosa and myself. And soon we'll have been joined by another cancer survivor. And
your mouth to God's ear.
Absolutely. And I know over 20 colleagues of mine in our age groups with prostate cancer and still operating, and our electricians still climb out 5 floors with prostate cancer 5 years ago and fix our electricity. Thank you very much.
Thank you, Doctor.
Well, Madam Secretary, may I make an observation and ask you a question to see if you can tap the low-hanging fruits, motherhood and apple pie, to create 4 hybrids that can save $200 billion a year or $2 trillion a year in 10 years to help pay for the uninsured and help the small businesses. Observation. When President Obama said on July 29th in North Carolina and earlier at Cleveland Clinic, he was absolutely consistent. He hasn't changed. Absolutely consistent with his healthcare plan that he articulated during his campaign while I was one of his healthcare advisors. However, what we hear coming out of both houses of Congress is confusing, conflicting, and quote-unquote not true to the President's vision, thanks to the other party. The media has made the situation worse by wrongly labeling it socialized medicine, government-controlled medicine, ration, none of which is true, especially if we can create 4 sensible hybrids that I'm challenging the Secretary Sebelius. On the one hand, with the exploding cost of healthcare, it cannot be a band-aid treatment. On the other hand, we cannot throw the baby out with the bathwater. It has to be a delicate balance, and who best than President Obama and Sebelius to guide it with the help of the senators. No reform, or wrong reform can be equally disastrous. An analogy is that of a science fiction movie in which a meteor is going to hit the Earth. Doing nothing will allow the meteor to hit the Earth. A false move could blow up the Earth instead of the meteor.
So maybe you can get to the question.
Thank you. 4 hybrids. In order to solve the wastage and problems of a pragmatic medical record-keeping system and to be able to monitor quality and outcome, can you and President Obama help the country adopt standards, meaningful standards for an EMR that is not only robust to perform data analysis, but extremely user-friendly and affordable so that it does not burden the providers and make the doctor-patient relationship into a laborious data.
So let's ask that question. And actually, Dr. Lee, that is underway right now, thanks to the leadership of the Congress and the Senate.